Lots of websites rate physicians. What happens when the biggest corporation on the web gets involved? You're listening to ReachMD XM 157, the channel for medical professionals. I'm your host, attorney and Dr. Bruce Bloom, and I'm pleased to be speaking with product manager of Google Health, Dr. Roni Zeiger, a graduate of Stanford School of Medicine, a medical informatics researcher, and a primary care physician who sees patients evenings and weekends at a nearby clinic. Dr. Zeiger, thank you very much for speaking with us at ReachMD.
Thank you for having me.
So give us an overview of Google Health. When did it start? What's its purpose?
So Google Health launched quite recently, about 2 weeks ago. And, of course, we've been working on it for some time, about a year and a half. And if you think about Google's mission to organize the world's information, it's really not hard to extend that to one of the most important areas to all of us, health information. And while Google has a tremendous number of people coming and searching for health information on our search box every day, we think that we can probably do more for those people. And we think that Google's expertise and technology can be leveraged to provide users a tool, namely Google Health, to help them organize their health information.
Prior to working with Google, you went back and got your master's degree in medical informatics. What was that about, and how do you see medical informatics and medicine coming together?
Medical informatics could be summarized as being the intersection of computers and information technology with medicine. And that includes everything from the electronic medical record systems that many of us are increasingly using in our practices, electronic prescribing, all the way to more basic science questions such as, what do our genetics tell us about which drugs will and won't work for us because of our specific individual fingerprint, if you will.
One of the features that is or will be on Google Health is a physician rating feature. Tell us about specifically how that works on Google Health as opposed to how it works on other websites. And why is that in the mix of products or services that Google Health offers?
Part of what Google Health does is try to bring together the information that everyone is looking for. And we really have a lot of insights into what people are looking for because they often do it using our search box, and we study that very carefully. A lot of people do indeed look for physicians in hospitals, and that information is sometimes easy to find and sometimes hard to find. We actually have not done anything new there. Before Google Health and independent of Google Health, Google works very hard at providing local information to users searching for it. A very mundane example is just looking for a local pizza place or a local sushi bar. And so if you do that, we try to be smart and offer you, in addition to the fact that you may be just researching the history of sushi, we try to be clever and say we think that you might be looking for a local sushi bar. And so we'll give you local listings as well. And you can go directly to Google Maps, also called Google Local, and do those searches even if we aren't clever enough to know that that's what you're looking for. So in Google Maps, again, independent of Google Health, you can find physicians, and some of them have their address, the address of their practice, if that's public information that's been made accessible to internet search engines such as Google. Some of them have, just like there are currently on the web today, reviews of pizza places that Google users have entered. There, frankly, are already some reviews of physicians. And Google Health has provided essentially a link and embedded those Google Maps or Google local search results inside of Google Health to point people to that in case that's what they're looking for. And the one new thing that we've done is that if you are able to find, say, a physician that you're looking for, perhaps one that you already work with, we enable you to import their contact information that's listed inside of Google Maps into the Google Health contacts list, because a lot of our users, as we did user studies and researched what features we should and should not include, told us that they would like to have a convenient place to list their doctor and their pharmacist for easy access. So physician ratings is something that's happening. I think it's a really interesting topic that we have a lot to learn about, and it's something that's out there on the web, and we are indeed pointing people to it.
So it sounds like, at least for right now, it's more of a passive component of Google Health than an active component of Google Health.
I'm not sure either of those words is exactly right. It's something that users have access to. I will say that this is an area that I personally believe we should go quite slow in. The whole notion of physician ratings and how do we measure quality in medicine is a fascinating and complex area that, really is a new field that we're just beginning to learn about. I think there is a place for consumers learning about what others have had to say about physicians, but we need to make sure that that's understood, that that's exactly what it is, and it's not necessarily reflective of how good technically a physician may be. Many of us have probably had experience with physicians who are absolutely amazing diagnosticians and clinicians, but don't necessarily have the best communication skills. And there are many examples of the exact opposite. And as we as a community, as a health community, move forward in trying to define what quality really means and how we can improve quality to better the care of everyone, that's something that Google will be paying attention to and trying to learn from. But we certainly don't pretend that that's a solved problem.
In this current version of Google Health, are patients able to download other information from their healthcare provider besides the contact information?
So if you find your physician or a physician that you're interested in Google Maps, and that's something that's also embedded within Google Health as a pointer to that Google Maps product, and their contact information is listed there, that's something that you can import into your Google Health contact list. There isn't anything new about, quality metrics or anything else that you can import about your doctor.
What about my own medical information? So if this physician's on the web and has a website or electronic medical records in their office, can this version of Google Health help me download that into my medical profile?
It sure can. So if your physician works for an organization or his or her own practice has decided to integrate with Google Health, and that's something that technically has become quite easy to do using our very standard programming interfaces. Of course, it does require a programmer to work with you. Then that physician, having done that, now has given the right to all of his or her patients to get a copy of their records if they want to and put a copy in their Google Health profile. So today, patients who get care at the Cleveland Clinic, at Beth Israel Deaconess Medical Center in Boston, at Walgreens Pharmacy, who get some of their labs drawn at Quest Diagnostics, who are customers of Long's Drugs, and several other providers, all of those patients now have the right, if they wish, to get a copy of their records and put them in their Google Health account.
If you've just tuned in, you're listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I'm your host, Dr. Bruce Bloom, and I'm speaking with Product Manager of Google Health, Dr. Roni Zeiger. So you mentioned that any physician could become a partner with Google Health if they're willing to hire a programmer and use the interface. Let's talk a little bit more for our physician audience about how long does that process take? Are there costs associated with it? And what kind of protections do the physicians have that nobody's looking in on their data besides the individual patients?
Sure. I think the best way of thinking about how I would look at this if I were, say, a typical physician working in a 1 to 5 person practice, or even if I'm part of a larger group, the most common method of integrating with Google Health is via the electronic medical record system that you use. So let's say that you already use one, and of course we know that today that applies to a minority of physicians, but that minority is increasing and will eventually become a majority. Let's say you already use a given system. Some of those systems are working with us to be basically compatible with Google Health out of the box. So as we move forward, you can expect to learn, as you're choosing which electronic medical record system to purchase for your practice, that if you think your patients will find value in using Google Health, you might consider choosing one of those systems that's already connectable to Google Health, plug and play, if you will. And for those that aren't yet, there are an increasing number of expert programmers out there who are learning how to do the, frankly, from a technical perspective, pretty simple integration between a given electronic medical record system and Google Health. And we've seen that process take anywhere from a few days for a small and nimble organization to several weeks for a more complicated environment.
Is there a list anywhere for physicians of the systems that currently are integrated or are working to integrate with Google Health?
We haven't published a list yet, but you should see that coming relatively shortly. You can get a good idea of the systems that we are integrated with currently by looking at the product and looking at the import medical records section, and those are the systems that are already integrated with us. So technologies that are used by those providers are the ones that we have been working with so far.
And in the future, do you think Google Health will become a resource for physicians as well as for patients?
It's a great question. And I think it's important to remember that Google is absolutely a consumer-facing company. We're not healthcare experts. We don't pretend to become healthcare experts. At the same time, I certainly know as a physician and as a student and as a Google Health team member that physicians are using the internet as much as anyone to look for information, sometimes in real time with patients. I find it incredibly useful to do searches at the bedside, if you will. I turn the computer screen to make sure that the patient can see it as well as I can, so that we understand that the computer, that information is really helping us communicate and facilitating us getting the job done together, as opposed to appearing to be a barrier or something that only I have access to. And I certainly am constantly looking for answers to my questions on the web, using public resources, proprietary resources, what have you. So while I think that Google will continue on its path to being a completely consumer-facing company, I think some of the things that we're doing will indeed increasingly apply to physicians. And we're certainly open to ideas. Google Health is just in its infancy. We're evolving, and we want to know what people need. And Google is an innovative company that is looking to solve interesting and hard problems. So tell us what you want and take a look and see what we already have and see what problems it might already solve for you. You can find Google Health. It's probably not too hard to find, but you can find it at www.google.com/health.
And if I'm a physician and start to look at this and have some feedback for you, what's the mechanism for getting that information to Google Health?
There are links at the top right corner of the application that welcome feedback, and we read every single piece that comes in.
So you said Google was launched in May of 2008. In the short period of time since then, have you gotten feedback from physicians about this product?
We've gotten a lot of feedback, believe it or not. The feedback that's sort of hit home mostly are, of course, some wonderful thank yous. We've had several physicians tell us, we are going to encourage all of our patients to use this. We think this is a really potentially powerful tool. And frankly, from all over the world, we've had a lot of feedback saying, when is this coming to our part of the world? We've had physicians share with us that there are things that are missing from the product that they'd like to see. And of course, we're always listening to that advice and prioritizing what features to work on next. We've had people tell us about typos that they're seeing, and we correct those as quickly as we see them. So feedback has ranged from all over the place, and it's been delightful to see what a warm reception we've gotten so far.
I'd like to thank our guest, Dr. Roni Zeiger, Product Manager for Google Health, for giving us a glimpse into the beginning of this healthcare portal. I'm attorney and Dr. Bruce Bloom. You've been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. Please visit us on the web at reachmd.com, which features our entire library through on-demand podcasts, or call us toll-free with your comments and suggestions at 888-MD-XM 157. And thank you for listening.